Okay. But Dr. Neha, also my question to you is, what are the major reasons for UTI? I mean, hygiene is the problem when the toilets are not cleaner and, the public washrooms with infections or with germs in it. But apart from that, what are the other reasons for getting this infection?
Apart from this, the other reasons being like unawareness, then drinking less water, especially during the summers, holding urine for the longer times, and
Mm-hmm.
also there is a predisposition in the females, honeymoon couples, and also during the pregnancy and in states of your decreased immunity,
Mm-hmm.
diabetic persons, whose blood sugar levels are not controlled, or any
Mm-hmm.
neurological problems,
Mm-hmm.
any stones in the urinary tract.
Okay.
These are the other reasons for urinary tract infection. And if we ignore the symptoms and if recurrent infection occurs again and again, then it can
Yeah.
lead to the infection of the ureters, and it can also go up to the kidneys, which we call
Mm-hmm.
as it is pyelonephritis. So these are the consequences.
Okay, so sexual intercourse is also a prime reason for this infection, UTI?
Yes, in the newer couples
Mm-hmm.
who recently started the sexual activity,
Mm-hmm.
it can lead to the females, they are predisposed for urinary tract infection.
Okay, but I mean, many people know about, hygiene and not using public washrooms, and these are the ways how you carry the infection. But not many people know about the thing that you actually have told right now, which is about the sexual intercourse thing. That, when you stated that the newly begin couple who actually have recently started the sexual activities, so they generally get these infections. So for them, I would like to know from you if you can please educate them about what should they do and how should they take care of themselves so that they don't carry this infection further.
Okay. Uh,
Yeah.
for them, the advice is always clean before and after the intercourse, and
Hmm.
also urinate before and after the intercourse. And it is
Okay.
always good to wash your intimate parts with clean water and wipe them
Hmm.
down from front to back rather
Hmm.
than from back to front. Because if we wipe from back to front, the
Hmm.
infection which is around anal area, it can ascend up to the urethra. So
Okay.
always we should wipe from front to back.
Okay. Okay. Now, Dr. Neha, with this, I would also like to know, there are a lot of products in the market in the name of, for these things, for especially for the UTI thing, because, now that I think in the recent times, this infection has grown tremendously because people are traveling and so many things are using this public toilets. So, I also would like to know from you. So, a lot of products have come into the market, some in the name of Be Safe and these all things. So would you recommend it to your patients, or would you say that you should carry Be Safe with you, or because they might also carry some chemicals in there, those products. So would you recommend it, or is it safe for people to use?
No, it is not necessary, but you can use it. Like that sanitizer sprays, they are available in the market. You can keep it in your bag and you can use it using a public toilet or common toilet, which is very much necessary because we are spending a lot of time outside our home, at our workplace, and
Hmm.
you can't avoid using common toilets. So we can use that
True.
sanitizer sprays. But the most important thing is to practice the hygiene, that is cleaning with
Hmm.
water and wiping with a clean cotton cloth or any tissue papers, and wiping always from front to back. And other than these, you should drink lots of plenty of water, plenty of drinks. You should
Hmm.
avoid caffeine, alcohol, sugary drinks. These
Okay.
are, and you should not hold urine for the longer times.
Hmm. Hmm.
You
Okay.
should
But also,
keep in mind
yeah,
all these things. Okay.
all these major points. Okay, great. But doctor, also with this, you have already mentioned the remedies that one should use. As in, you have told that you should not hold your, urine for a longer period. You should maintain the hygiene and alcohol and these medicines you have already told to the people if they go through a problem like this. But with this, also, I would like to know from you that are there any home remedies? Being a doctor, I know that you would not recommend it, but even though, because there are so many things, medical things that are available in the kitchen. So, would you recommend any such home remedies that a patient can use if he or she is going through this problem?
Uh, Mainly, we suggest to drink lots of water,
Hmm.
especially water and cranberry juice. It is also recommended
Okay.
in lot many studies. It is found that the cranberry juice it is helpful in treating and preventing UTI. Not in the treatment, but in preventing UTI because it is seen that cranberry juice it prevent that sticking of this bacteria to the urinary tract. The
Oh, okay.
lining of the urinary tract, it prevents the attaching of the bacteria to the lining of the urinary tract. So this cranberry juice, it is recommended. Other than these citrus juices, citrus fruits,
Okay.
vitamins, zinc, all
Vitamin
this
C.
you can take to prevent UTI. And other than this, if I can suggest you, you should not use that spermicidal and lubricating condoms also.
Okay.
For sexually active females, I recommend this.
Okay. 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 That's okay. You have told some great remedies, home remedies also. So now with this, my next question to you is there are a number of times when suddenly such problem occurs. So, I mean, with alcohol and things, are there any medicines in particular that one can carry in their bags if they are traveling or if they are, out of their the homes or somewhere? And if they get these problems, so suddenly such problem occurs. So, is there any a medicine that you would like to recommend that one can carry all time?
No, I would not recommend to carry any medicines because in that case you should consult your doctor whether on phone or online consultation.
Okay.
You can take that alkazol citrusol to relieve the burning if immediate
Mm-hmm.
consultation it is not possible. So
Mm-hmm.
always you can do that online consultation. So in that case, doctor would recommend some tests like urine test or urine routine microscopy, urine culture, and he will recommend some empirical treatment for the time being. Then as soon as you come back, you can see your doctor.
Mm-hmm. Okay.
But
Okay.
finally,
So,
you should not take the over-the-counter medicines or any treatment which are research on the Google. You should not depend on the treatment for Google. You should always see your doctor if the problem persists or it is increasing or worsening.
okay, okay. So you should not go to when you get the sensation of burning and all these things, and if you get the infection. So yeah.
Symptomatic treatment you can take, but you should not take the antibiotics without doctor's prescription because
Oh,
antibiotic abuse again lead to the microbial development of the microbial resistance, and in that case, then antibiotics would not be effective then.
right, right, right. Definitely, definitely.